Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk about the process of assessment, diagnosis, and treatment. And as you will see in this video, that is the proper sequence when approaching working with potential clients. The assessment process is designed to help a person formulate whether there is a condition that needs psychological treatment. The diagnosis is a framework by which we look at the condition of interest, and then treatment is how we address the problem. So without further ado, let's get into it. So clinical assessment is a systematic process by which we try and use strategies to understand children that have some form of a disturbance and their family and school environments. And typically, we'll see in another video, we do a multimodal assessment. That is, we take in information from all of these aspects. So the individual, the family, and the schools all inform what's going on. And that clinical assessment helps us achieve solutions to whatever the challenges that the children and their families face. And because we're working on assessment in children, it's very important, as I've said in other videos, to focus on not just the impact to the child, but the impact on the family, as well as the role the family plays in driving some of the concerns that the children display. Now, there are two different lenses that we look through when doing an assessment. We use both an idiographic and nomothetic approach. An idiographic approach just says, I want to understand the uniqueness of the individual. So I am focusing on information about the child or the family as a unique entity. I am not treating this child or their family like any other cases I'm working on or any other people that I'm providing therapy to. So an idiographic approach focuses on the uniqueness of the individual or their family, whereas a nomothetic approach focuses on norms, large-scale norms. And because we've said that when it comes to development, there are expected milestones that a child is supposed to reach, we do compare the child in that regard relative to the expected norms of a larger group of individuals. So what's really, cool about proper clinical assessment is we both take the uniqueness of the individual's experience while also, comparing some aspects of who they are relative to their peers. So when doing a psychological assessment, you also have to be sensitive to the child's developmental age. And one's developmental age is different than their chronological age. What do I mean by that? Your chronological age is how old you are based on your date of birth, whereas your developmental age is how you function in a domain on this developmental issue. So if I were looking at intelligence and I was doing a psychological assessment for intelligence, I could do an assessment of a child who is 8 years old and then say their IQ puts them roughly around, I'm making up a number, 6 years old, 8 months. So I can be very specific as to their IQ, where their developmental age is. We also have to pay attention to gender, because gender plays a role in a lot of things. Referrals, right? So there are certain characteristics that push individuals into an assessment. So gender impacts why people are referred for an assessment. It also impacts treatment. I will also say the kinds of diagnoses that emerge from assessment oftentimes look different based on gender. So you will see a general pattern that mood and anxiety conditions tend to have higher rates with females, whereas more cognitive and learning related conditions have higher rates of diagnosis with males. So it wouldn't be uncommon to diagnose a male with ADHD at a greater frequency than a female, and major depressive disorder. It wouldn't be uncommon to diagnose a female at greater rates than a male. And I'll go through that a little more shortly. We also have to pay attention to culture and how culture plays a role. If you don't engage in a culturally appropriate assessment, all of your findings are invalid, right? Because we have to be sensitive how culture impacts the way we orient ourselves in the world. So, moreover, we have to be mindful that there are certain conditions which are referred to as culture-bound syndromes. And when we diagnose, we are generally diagnosing a psychological disorder with something we believe that is a uniform issue across the globe. Here are the features. If you have these features, you would be diagnosed with this condition. However, a culture-bound syndrome is exactly that. There are certain conditions that are unique to a given culture. For example, ataxic which is an experience of severe anxiety, is very common in Latin communities, even though it doesn't fit the proper framework of a panic disorder. That's an example of a culture-bound syndrome. Now, the DSM-5 has a whole section dedicated to culture-bound syndromes to help those of us who are providing an assessment to have a better understanding of things that we might think are pathological but don't fit a framework that might just be culture dependent. And that brings me to my second point about culture, is what we considered typical or quote unquote normal versus atypical or quote unquote pathological may vary from culture. So we have to be very, very careful not to over pathologize things that might be considered normal according to one's culture. Another example is the idea of talking to the dead, or believing that the deceased talks to one. That differs from culture to culture. If a person comes into your treatment room and says, you know, my grandmother talks to me at night and she's deceased, the natural reaction is, okay, are you hearing voices? You might think of this as a pathology, when in both Latin cultures and East Asian cultures, there is an emphasis and connection with the deceased. And that's not considered atypical or pathological. So we really, really have to do a good job in knowing the culture of origin of our clients when doing an assessment. Now, I said to you that certain conditions are going to show up more frequently amongst males. Others are going to show up more frequently amongst females. And then there are some conditions that are roughly equivalent. So if we look at ADHD, well, ADHD is a cognitive-based disorder. It fits that prism of, yeah, that makes sense. It's going to be more common amongst males relative to females. Intellectual disability, again, it's IQ-based as well as adaptive functioning, so that has a cognitive component. Autism spectrum disorders have a cognitive component, and so forth. Now, if we look at amongst females, eating disorders are significantly greater amongst females. And it could be how we socialize our children and the implicit messaging that young girls get about what body type is attractive. Now we talk about anxiety and adolescent depression. You see this shift because these are mood and affective conditions. Now, what I didn't talk about are the concept of internalizing versus externalizing disorders. So internalizing disorders are things or disorders that we process inside of ourselves. So not only would anxiety and depression be a mood or affective condition, it's also an internalizing condition because we process that inside of ourselves. Whereas conduct disorder or oppositional defiant disorder, these disorders are externalizing. Now, we see in childhood, not as much in adolescence, that oppositional defiant disorder and conduct disorder tend to have higher rates among males because that's externalizing. So there are gender patterns that we certainly would want to keep an eye on. Now, I said we take a nomothetic and an idiographic approach. When we look at a nomothetic approach, we're looking at normative information. So we're comparing this child and their development relative to the developmental norms of their age mates, of people who are roughly the same age. And it's important to be able to do that because how do you know if someone has a delay, whether it be a speech and language delay or a learning delay and so forth, right? So we're going to compare the output, the behavioral output relative to age groups. And if we're looking at symptoms alone, individual symptoms do not really link themselves very well with children's overall adjustment. However, if you want to see things that are linked to childhood disorders, age inappropriateness, right? So not reaching the proper developmental milestones, right? So competency-based issues. The severity of symptoms and pattern of symptoms, all of these are incredibly important when it comes to the issue of diagnosis in children. Sorry for that pop out on the screen. All right, so let's talk about parent and teacher related concerns that help with coming to a given diagnosis. Parents and teachers talk about relative happiness or unhappiness, concentration, disobedience, impulsivity, distraction, moodiness. All of these are characteristics that discriminate between a child with a condition and a child without a condition. So, yeah, I'm going to pause for a second and resume because I keep getting messages coming in and they're disturbing the video. Okay, so let us continue with the purpose of assessment. Well, you're going to hear this pattern: assessment, diagnosis, treatment. And it goes in that order. So the first thing you're going to do is a proper assessment, right? And a proper assessment involves a clinical description of the behaviors, thoughts, and feelings that might make up or comprise this child's psychological disorder. You want to put an emphasis on intensity, frequency, and the severity of the problem, as well as the age of onset and the duration. So all of these allow you the backdrop. Providing that the child meets the criteria for a psychological condition, you will have a diagnosis. Now, I said providing that they meet the criteria. I would also acknowledge that not every assessment leads to a diagnosis. I've had people bring their child in and say, hey, I think there's something going on with my child. And we do a proper assessment, and the child is developing just fine. And I have to deliver news to the parents, no, your child is doing okay and does not need a diagnosis or services at this time. But let's assume that a psychological disorder was revealed through the assessment, then you're going to have a diagnosis, right? And the diagnosis are the conclusions that we make about whatever the problem is based on the symptoms or features of that condition. So there is the diagnosis, and then there is a problem-solving analysis, which leads us to the concept of treatment, which is our process of doing therapy with an individual who has a certain diagnosis. So assessment, diagnosis, treatment, right? So once we have a diagnosis, we're going to evaluate the prognosis. The prognosis is just a fancy way of, okay, what is their likelihood of getting better, and how far can we bring them towards optimal functioning? So a prognosis is a prediction about future behavior with treatment, right? Now, then we develop our treatment planning and evaluation. A treatment plan, usually you would establish a treatment plan within the first 3 sessions of meeting a client. And then you would establish a certain series of goals and objectives for that initial 3 months. And then you do a treatment plan review every 90 days or fewer. I say or fewer because it's possible that something might trigger the need for a treatment plan review earlier. But either way, that gives us a roadmap on how we're going to address the symptoms of our client. And so our treatment planning allows us to establish a way of interacting with our client and helping our client, as well as it allows us to evaluate our effectiveness in our treatment, right? So that's the treatment process. And we'll talk about different therapy models, but that's where I want to stop for now here. So, okay, that is the video. I hope you found it useful. Sorry for the pop-ups. I tried to block them from coming in, but they just popped in a few times. I apologize. If you found this video useful, please consider subscribing to the channel, hit the like button, click the notifications tabs. All of these things will send a message to YouTube that this video is of some value, and that will allow them to consider pushing it out to a larger audience. But I thank you for considering that. Also, I use the comment section as well. So please, if you had a particular question about the video, or you had a thought about the video, feel free to put in the comment section below. As I said, I read and respond to all of the comments. So I thank you for your time, and until next time, take care, everybody.